Hi, everybody. So today we're going to talk about neck pain and how to keep your neck healthy. But first we have to talk about what to do if and when you're in pain. And probably if you're watching this, you are having pain in your neck, or you have at some point struggled with this. We know that at any given point, 10 to 20% of the population is having neck pain. And in the past 6 months, over 50% of the population has struggled with some kind of neck pain. So it's very common. I understand the implications because I myself have struggled with issues in my neck for over 15 years now, and it's really limiting. Your neck is involved in almost everything that you do, and it is our means to brain-body connection after all. So it's really important to address, and I work with quite a few patients who have issues ongoing in their neck or acute issues, and it can be really helpful for people to have someone to help them manage it, even though oftentimes it is possible to manage on your own. So the purpose of this video series is to give you some tools, either to manage it on your own or know where to start if you're going to seek help from a professional like myself, a physical therapist, or somebody else to get some hands-on treatment or guided exercise. So the most recent research and physical therapy guidelines show us that it's important to determine which category of neck pain you fall into. And that doesn't have to do with the anatomical diagnosis of what's going on in your neck or an image, because we're learning more and more that has less to do with the actual pain that you feel. And it's more important that we understand what kind of limitations you're having. So based on that research, 4 different categories have been devised. And I'm going to go into detail in each of these short segments if you would like to learn more about any one of these categories. But first, it might be helpful to decide which category you most likely fall into. So the first one is neck pain with mobility deficits. And you're in that category if your primary issue is neck pain kind of in the center of your neck, right back in here, or alongside in the shoulders, but generally in the region of the neck, typically just staying really local, showing up like an ache or a pain. And you also feel some stiffness with this movement. So stiffness with any kind of movement of the head. The second category is neck pain with coordination deficits. And you're likely in this category if you have neck pain that's residual from a traumatic event like a whiplash or a fall, and or you have a sense of just like a lot of weakness, like difficulty holding up your head, or just like a sense that your neck muscles aren't where they should be, even if you're really physically fit. And then also you might have some kind of radiating pain down into the shoulder blade real light, or kind of maybe moving away from the specific area of the neck at times, but primarily neck pain and weakness. And then the third category is what we call cervicogenic headaches. And this is neck pain and headaches. So if you tend to get a headache in the back of your head, like kind of at the base of your skull, that usually radiates a little bit, generally one-sided, but sometimes both, in combination with the neck pain, you're probably in that category. And then the last category is neck pain with radiating pain. And that's characterized by pain that's really running down one or both arms, usually just one. And that's kind of the hallmark of that category. A little bit different than that second category of coordination deficits, where you might just get a little radiating pain into the shoulder blade. So whichever one of those 4 resonated most with you is probably where you would start with if you were to work with a physical therapist, or the video that you should watch to get some ideas for exercise. Then that's not to say that you don't fall into maybe 2 categories or you don't fit cleanly into one, but it's just a starting point. So, and I also should say that if you have had a recent traumatic event and you're having neck pain that is creating some of that radiating pain down the arms, it is important that you go and get further evaluated first with an X-ray or potentially an MRI. So if you have questions about that, feel free to give me a call and I can direct you in the right the right place, or you can go see an orthopedic physician. There's several different avenues, but you really should get that further evaluated to clear out anything that could be wrong. So that's where we'll start. So stay tuned for each of those 4 videos. And then in the 5th video, we'll talk about how to keep your neck healthy when you're not in pain.